A patient today asked me about anxiety in general and asked me why it's so hard to break a cycle of having increased anxiety about something in particular, and then basically running away from that thing, avoiding it, and then being stuck back in the same place that they were when they started, in terms of when that thing came up again, feeling that anxious response and having the same thing happen over and over again. So the example that they gave was that when they have a talk to give at work or a speech to give at work, they would start to feel anxious about a week ahead of time, and that anxiety would increase day to day, would increase and increase and increase until the morning of the day of work where they had to give that talk to a couple of people that they worked with. And then they've actually been recently calling out sick on that day. So missing work because of the anxiety that they had about giving a talk to people at work. So this is an instance where the avoidance that they were having related to their anxiety might actually cost them their job. So this is a pretty serious situation. And what we talked about was the anxiety cycle. And what happens, I'm going to draw this out a little bit. This individual, he's told, all right, you have a speech to give at work. You've got a talk that I want you to give, right? He's doing fine. He's kind of hanging out. Mood's okay. Anxiety's okay. And then if you think about anxiety, the higher up you go, the more anxiety that you have, right? Person starts thinking about this talk. His anxiety is going up, and it's going up, and it's going up. And he's starting to feel a lot of distress. He's starting to feel a lot of anxiety and a lot of panic. It's the morning of the presentation, and he calls out sick. So he calls out sick, boom, his anxiety starts to drop. He knows he's not going into work. He knows he's not giving that presentation. And his anxiety comes down. And because he knows that he's not going to have another talk to do for a while, his anxiety might actually come down below where he had originally started. So he might actually have a little bit less anxiety than he does have on a typical day. And then, a few days later, a few weeks later, he's back to the same situation at work. He's going back into work. He's doing okay. And then his boss says, hey, I'd like you to give another presentation. I think you missed that last one, and tomorrow might be a good day, or a week from now will be a good day for you to give a presentation. And then the anxiety goes up, and it goes up. And then he calls out, and then his anxiety goes down. And then a week later, he's in the same exact situation. So this is why it's called an anxiety cycle. It's just the same cycle over and over again. And this individual, if you see here, what is causing his anxiety to drop? What is causing his anxiety to drop? He is teaching himself, he is conditioning himself that to treat his anxiety, what he needs to do is run away from the thing that's making him anxious. He's conditioning himself that to treat his anxiety, he has to not give the presentation and call out sick from work. Now, I think that it's pretty obvious, probably to anyone out there, that is not an effective coping mechanism. That's not a healthy way to condition yourself to treat your anxiety. And so what you can do, instead of being stuck in this anxiety cycle, you can actually use exposure therapy. And exposure therapy is exposing yourself to the thing that makes you anxious and doing it over and over again until you start to get bored. And so in this case, while I can't recommend that he starts to offer to give public talks or speeches at work every single day, because that might not be possible and also might make him look a little bit foolish, or might also jeopardize his job if he's suddenly demanding that, what we decided to do was actually have him come up with some presentations or some talks similar to the same content that he would be delivering at work, and to give those talks to me at our sessions. And to do it, we would prepare maybe a minute or a couple of minute talk, have him do that same talk over and over and over again until he started to get bored. So the first time that he did that, his anxiety was going up as he was giving the talk, and it was going up as he was giving the talk, and he was doing it again and again. Anxiety, he started to actually panic in the office. But after doing it about 30 or 40 times, then he started to get bored, and his anxiety came down, and it came down back to his baseline about 10 or 15 minutes later. So here, he's teaching himself that to break his anxiety, to cause his anxiety to drop from its peak down back towards his baseline, you just need to keep doing the thing that makes you anxious. Then at his next session, the hope is going to be, and I anticipate this happening, we're going to do the same exact thing. We're going to have him give the same 2 or 3 minute talk over and over and over again. And I anticipate his anxiety is going to go up, and it's going to go up, but it's probably not going to go as high. It's probably going to not last as long before it comes back to his baseline anxiety. And then he's going to come in for his next session, and we're going to do the same exact thing. And I anticipate that at this point, he's probably going to start to be pretty frustrated by this and just start to think this is kind of getting ridiculous. And he'll give that talk over and over again. Anxiety will go up, but not too high. And then it'll break. And then it'll start to come down. And the next session, it probably is going to look something like that. And then after that, he's probably going to be like, wow, giving that speech, at least in my office, to me, is really no big deal. And he's not going to have very much anxiety about it. And he will have conditioned himself that to break this pattern, to break his anxiety, to treat his anxiety, he just needs to keep doing the thing that makes him anxious. Now, when he goes to give that speech at work, it's going to be a lot more tolerable. The idea of giving that speech will be a lot more tolerable and cause him less distress. It's still going to cause anxiety. It's still going to cause distress. But by doing it over and over and over in the office, it'll be a little bit easier to do. And then once he's done it, then my recommendation is going to be try to offer to give talks a little bit more often at work. And if you want to practice them with friends or colleagues or your significant other a few times before you give it, it might make it a little bit easier. But my guess is that if you go through this process, it's going to become easier and easier over time, and you're going to become habituated to the stress response that you were having with the idea of giving a talk at work, and you're not going to be in jeopardy of losing your job. So if you have any questions about this or want to explore cognitive behavioral therapy, please reach out to a provider directly to discuss.